Knock knock. I
Hello.
did my hand hygiene. Hi, my name is Angela May. I'm the nurse practitioner student. If you don't mind, I would just like to do a ears, nose, and throat assessment on you real quick, okay?
Okay.
Do you mind just telling me your name and date of birth?
Gabriel May, 3-3-2000.
Alright, perfect. The patient is awake, alert, and oriented times 4. The patient is showing no signs of acute distress, and vital signs are normal. So, just inspecting the ears. The auricles are symmetrical. He has a little bit of arrhythmia going on, but besides that, everything is symmetrical. It looks intact. I don't see any lesions or masses or anything like that. So I'm gonna palpate the auricles, okay? And just tell me if you have any tenderness at all.
No.
Alright, sorry. Palpating the tragus. Any tenderness?
No.
And then any tenderness when I palpate back here?
No.
Alright, perfect. So there is no, while palpating the tragi and the mastoid and the auricles, there was no masses, no edema, and no nodules or tenderness or anything like that. I am going to look at your the inside of your ears in a second. I just want you to do me a favor. I'm going to repeat back 3 things to you. What I want you to do is I'm going to stand a few feet away. I just want you to cover the one side of your ear so you can only hear out of the one side, okay?
Mm-hmm.
So cover the other ear. And I'm just going to whisper 3 things. I just want you to whisper them back, or say them back to me. 99 baseball orchid.
99 baseball orchid.
Perfect. And then close the ear on the other side. Thank you. And I'm going to do the same thing. Water, 66. Bucket.
Water, 66 bucket.
Perfect. All right. Gross hearing is intact bilaterally. If requested, I would do a Weber and ring testing. I'm gonna use this otoscope. I'm just gonna look at your ears real quick, okay?
Okay.
Just let me know if you have it. It might feel like a little weird, but you shouldn't have any pain or anything. All right. The external ear canal. Sorry. The external ear canal is clean and intact. I don't see any arrhythmia, no excessive serbium. Sorry, I'm just gonna insert this, okay? Alright. Sorry about that. Alright. The tympanic membrane is intact. It's pearly gray. There is a good contour, and the cone of light is there. There's no perforations or anything like that of the right ear. I'm just gonna come up on the other side and do the other ear, okay?
Okay.
Alright, external ear canal is clean. Sorry, hold on. Just gonna pull your ear back, okay? Alright, perfect. So the external ear canal, it's clean. There's no arrhythmia, no lesions, no discharge in both ears, no edema, or masses or anything like that, no foreign bodies. And then bilaterally for the tympanic membrane, it was pearly gray. with good contour, the cone of light's there, no perforations or anything like that, okay? And then if needed, I would do a pneumatic otoscope, or I would test the tympanic membrane mobility with a pneumatic otoscope. I'm just going to look at your nose now, okay? Nose is symmetrical, there's no masses or lesions or anything like that. I'm just going to palpate, okay? Any tenderness at all?
No.
No? Alright. No tenderness, no masses, no edema. I'm also just going to palpate your sinuses real quick, okay? Do you have any tenderness when I do that?
No.
What about up here?
No.
No? Alright, there is no tenderness of the frontal and maxillary sinuses. And if needed, I would do, If needed, I would do a sinus transillumination just to see if there's like any blockages or anything. I am just going to, just do me a favor, breathe in. Alright, breathe in again. Alright, nostrils, and the nares are patent bilaterally. So I do not have the attachment for the, to use like the nasal thing, so I'm gonna have to just use my pen light for right now. Alright. So the nasal mucosa is pink and moist. There's no like swelling, no bleeding, no exudate, ulcers or polyps. The septum is midline without any deviations. There's no inflammation, no perforations. I'm just going to look at your mouth, okay? Alright? And then, sorry. I'm looking at the hard palate. Can you do me a favor and stick out your tongue? Alright, and then can you stick it out a little bit wider and say ah? Alright, stick it out more. There you go. And say ah. Perfect. Alright, so the lips are intact, they're moist and pink. The oral mucosa is pink and moist. There's no ulcers or white patches or nodules. The hard palate was intact. There's no like lesions or masses. The tongue is pink, midline, and moist. There was no lesions as well. Pharynx, pink without like swelling, symmetrical. Sorry. The tonsils are symmetric without swelling or exudate or ulcers. The soft palate rises symmetrically. I just need to look at your teeth, okay? The gums are pink, moist, and intact. There's no missing teeth. No cavities or anything like that. And then I am just going to, so I'm just going to touch your tongue real quick, okay? And then do you mind lifting your tongue up? Alright, there's no induration at all. And touching the gums, you don't have any tenderness, right? No tenderness, and then, how do your teeth feel?
Good.
Alright, and there's no loose teeth or anything like that. Trying to think if I forgot anything. No tenderness of the gums, yeah. Alright, that includes my ears, nose, and throat assessment. I did hand hygiene after taking my gloves off.